And we've got another question for you from Hanif. Hanif?
Pardon?
Thank you, Chair. It wasn't so much a question. I was just following up Michelle's point about actually getting copyright on those brilliant quotes. In the one I loved was right at the outset. That almost should be at the beginning of our strategy paper. If you get your health right, you can get the rest of your life sorted. So I just really related to so much of what Graham said, and that aspect of understanding things from a patient perspective was just so integral to everything we do. So I just wanted to thank Graham for his time, and as they echo what Michelle said, I think we've got half a dozen quotes there that we need to copyright for NHS Humber.
One thing about me, you can have a good laugh with me. I met people laugh.
Does anybody else want to ask Graham anything or make a comment? Have I covered everybody?
Yeah.
Can I just say, Graham, it's been absolutely delightful to see you this morning. And actually thank you for sharing some funny moments, but also thank you for sharing some tough times too. Because what I take away from this is that, you know, sometimes you have tough times in life, and you've talked about that today. But if you've got the right help and support, actually you can have happier times too. And I think that's come across so much. Your teeth story, I was at the dentist yesterday, so obviously I was thinking about that when you were talking about your teeth. But my granddad, when we were little, used to take his teeth out. I don't know whether he was trying to make us laugh. He used to do that to us on a regular basis, Graham. So I really, you made me think about my granddad this morning, which was a lovely memory to have for me too. But it's been fantastic. And I don't know about the book. I'm thinking Graham the movie. I mean, honestly, it's been a wonderful opportunity to share this time with you. And I hope people who are watching this morning, you know, take a lot of stuff away from this. It is really positive, because I can't believe they wouldn't. So thank you so much for being with us, and all the work you have done, but all the work we rely on you to do going forward. We need people like you, Graham. So thank you so much.
Okay, it's my pleasure. I've been looking forward to this day for a very long time. Okay.
Thanks, Graham, and thanks Tom and Mandy. We're giving you a big round.
Well, thank you. Thanks very much.
Brilliant. Have a great day. Right. That was brilliant. I think we all, you know, took the comments and questions reflected that, and what a great way to start the board today. We've still got Mandy with us, because Mandy's going to deal with the patient and care experience, including Complaints and Powers annual report, Mandy, aren't you, for us? So over to you, and thanks for your support during that last item as well. Thanks, Mandy.
Thank you very much. Thank you. I'm just going to say bye to Graham, if that's okay, because I think he's leaving the room in a second. So, okay. Oh, that's lovely. Okay, so bye, Graham. Reception's just there on the left. Is that okay?
No.
Excellent. Okay, well done. I'll catch up with you later.
Okay.
I'll give you a ring.
Yeah.
Okay, sorry.
That's fine.
You take care, won't you?
So, Patient Care Experience Annual Report 2020-21. So, I'm taking it that everybody has read the report. Just want to pull out some key messages and to remind everybody that there is a comprehensive 44-page report that's got all the detail that backs up the report in the digital electronic version. So, some of the key highlights. First of all, the surveys that we carry out within the Trust. So we have the Community Mental Health Annual Survey, and we also have the Inpatient Survey and the GP Survey. We have systems and processes in place, working groups in place to understand what the information is telling us and to develop action plans to ensure that where there are areas for improvement, that we're actually putting those actions into place. And we have patients, carers and service users on the inpatient and the community mental health service user surveys now to help us with the action planning process. So things have really moved on over the past couple of years or so with regards to how the divisions are earning the data and are making improvements on the back of the data. From a virtual perspective, over the past 12 months, everybody will be very familiar with all the forums that have gone virtual, also the church services that our Trust Chaplain runs, and the virtual awareness weeks that have really taken off across the Trust, to the point that I don't think a week goes by now that we don't have a virtual session of some kind in the organisation to share the great work that's going on in the Trust. And just to add in there, middle of October, we have 2 virtual sessions, awareness sessions on the Patient and Care Experience Annual Report. There's one session going to be on complaints and feedback, and the other session is going to be on the key highlights of the Patient and Care Experience Annual Report. There are a number of priorities that we've identified to take forward this year, and the key ones that I want to pull out here is the role of the panel volunteer. So the panel volunteers, patients, carers and service users getting involved in recruitment, that is happening across the Trust. But what we're doing is we've standardised the process, so where possible, frontline posts and senior management posts will have a panel volunteer on the panel. And that standardised framework is going to be getting rolled out over the next few weeks. We've also got a fabulous patient and carer experience training programme that's going on our recovery college. It's going to be a 9-module programme, and it'll be available for anybody to access, so any member of the public or staff, and it will be twofold. One for staff who haven't been informed on areas on the 9 modules, such as, I want to involve a patient on an interview panel, but I've not done this before, how do I do it? The training module is great to inform them, but at the same time, it's great to inform the public so they know what to expect when being involved on an interview panel. So, like I said, there's 9 modules. I won't go through them all at this stage, but we'll be doing a big launch of that in the next few weeks. So there's some key pieces of work going on in the background as we speak. Complaints and feedback. As with previous years, patient care and communications are the 2 top themes. The feedback's also telling us that back in lockdown 1, we had a national pause on complaints, which meant that complaints obviously were frozen. However, we unblocked the freeze in June earlier than the national request, so that we could start to get through our backlog. There was a reduction in complaints last year when COVID did hit us. However, over the past few months, we're seeing an increase again. So things have started to settle and patients are actually feeding back again for various reasons. But ultimately, communications and patient care. I think that's probably a good high-level synopsis, if anyone's got any questions.
Thanks, Mandy, very much. And just thank you for all the work you've, well, not just carried on doing, but innovating in the last 18 months. I think it's been really great. And obviously, with people now coming back in and raising their voice again, I'm sure you'll be back talking to us about what they're raising their voices about and what more we can do. But thank you so much for that report. Any questions to Mandy or comments colleagues would like to make? Peter, seeing you first, and then Mike.
Okay, thanks, Carolina. Thanks, Mandy. You know, you're doing a really great job. One thing you didn't mention there, and I'll just fly the flag for you a little bit, is the youth board. That, you know, the work that you've done to start that up, because I was involved in one of the workshops on that, and I was really inspired by some of the thoughts and the inspiration from some of the board members or the participants in that workshop. But it did strike me that some of the young people on that workshop were suffering from the fact that we were not face to face, and they were suffering from isolation. And it seemed to me that sort of board the individuals on it would benefit at some stage from a face-to-face meeting, you know, in terms of their own mental health, if you like. So I just wondered if there was going to be some scope for that, and perhaps also give you a chance to fly the flag on what you've actually been doing on that board.
Thank you, Peter. I mean, obviously, I'll be led by the trust and guidelines with regards to if and when we go virtual we go face to face, sorry. I mean, I am very keen in the future, when I'm allowed to do so, to have a blended measure of patients face to face and virtual. I know not everybody wants to go back into a room, but some people do. So I'll be led by yourselves with regards to the next stages.
Thanks, Maddie. I've got Mike next and then Francis. Mike?
Thank you, Chair. This report was considered previously by the Quality Committee, and I'm sort of trailing one of the reports that will come further. And colleagues will note that it was strongly endorsed by the Quality Committee. And we particularly noted the work that was being done even in the presence of COVID, and the proactivity that's taking place with all of these multiple strands taking place. My only worry, Mandy, is that we've only got one of you, and every time we turn around, you've done something different and you've taken on a new role. So just be careful. And also, I am able, because I do other roles, to look at our patient experience in comparison to other places. And well done for doing the triage service for complaints. It's very easy to either just dispense with too many informally, or to put everything through a formal process, and it becomes a tick box exercise. So tremendous work. Thank you very much.
Thank you, Mike.
Francis?
Yeah, Mike said much of what I was going to say. It was just to say you've really adjusted well. The report is excellent and probably doesn't do full justice to all the work you've done over the last 12 to 18 months. You continue to deliver a really, really great experience. So well done. It's fantastic. Thanks for that.
Thank you.
Great. And is there anyone else? Michelle, sorry, Michelle. And then John.
Morning again, Mandy. As always, I always say this, and I'll continue to say it, that Mandy's transformed the work of the patient safety and carer service. I mean, I remember what it was like. So thank you, Mandy. And I agree with Mike. You know, we need to make sure that you look after yourself as well. And again, the report is really great to read. I know that we have a lot on complaints and other quality look at them. I just wondered, I'm always a bit anxious about any areas that aren't getting any complaints. Because sometimes that can tell you more than the areas that are in some respects. And it's really great that we've learned from complaints. And I know that we do that because we do follow things through. I sign off and read every single complaint before it goes out of the organisation. But I just wondered, is there any areas that, Mandy, because it's not clear on this, and I know we do get other reports, but anything from you that is particularly flagging that maybe not getting as many complaints as we, because it's that feedback mechanism. I'm not saying that we should. I'm just saying sometimes it can ring more bells.
I mean, I think for me, where we don't see the informal or the formal complaints coming through, it's generally from experience and working with Susan, our complaints manager, because the teams, the service leads, are dealing with the concerns as direct feedback and mitigating before an informal or a formal complaint actually hits the organisation. So I think quite often it's down to very good senior managers, team leaders in our services actually supporting the complainant before we reach that next stage.
Okay, thank you.
We certainly can have a look to see if there's any teams out there that are raising a bell year on year that they're not actually experiencing any concerns, and see if we can, build a theme or a trend there. I'll certainly look into that, Michelle.
Thank you. It's just to make sure that people have got that. I'm not saying they haven't, but people have got that access to have those conversations and what have you. So maybe just a bit of work that we probably need to look at. So thanks, Mandy. Thanks, Chair.
Thanks, Michelle. And I think you mentioned earlier, Mandy, that it was often communications that was a problem, and actually maybe that's something to think about in terms of whether there's some just common issues, and that we have to constantly strive to make sure that we're listening to people and, trying to hear what they're saying. That sometimes helps solve these things for some of the complaints, I imagine.
Yeah, absolutely.
Thanks, Mandy. John, over to you.
So, thank you, Chair. Just as the exec lead, I just want to reiterate our collective thanks to Mandy for the work she's done over the past 4 years on leading this stuff. Interestingly, I think one of the strengths we now have is that we look out. So, Francis, we referenced the youth board. And actually, the youth board we stole from another trust, having seen a tweet about their youth board. And that's where that came from, Peter, interestingly enough. Likewise, in the Sway reports, you'll see that it's the so what questions with regard to the complaints. So the final page just gives some sort of brief stories of how a complaint made some changes. So we're not just talking about the data, it feels a little bit more real. And all of those were improvements we picked up from just looking at what other people were doing and dare I say, it's just being magpies and stealing the best ideas from other people, which Mandy, I have to say, is very good at. But what Mandy hasn't said is that actually the trust is seen as a benchmarker on some of this stuff, and you'll see in the Sway report that she has presented to NHS England our work around patient and carer experience, because we're seen as doing this very well. That's not to rest on our laurels. And just to draw the link between Graham and Tom, some of you will remember 3 years ago that Tom first came to board to tell a patient story. He then came to, was trained by the trust to do quality improvement, to work with staff around quality improvement as a bank worker, and now he's come into a full-time role in the trust. So it just shows you there is that golden thread going through our patient story this morning about how we can bring service users from the outside and into the organisation, and then actually back into full-time employment too. So there's a bit of a thread running through that work which Mandy has led. There will be a strategy refresh which will be starting sometime next year, but we're already doing lots of good stuff, and imitation sometimes is the best form of flattery.
Thanks, John. Any final word from you, Mandy, to keep us on our toes?
Just thank you all very much, and please keep coming and supporting the forums and the sessions that we put on in pace.
Thanks, Mandy, very much. And also, you know, I haven't met her yet, but I really want to meet Eve Rose, our chaplain, who I see from the report won an award from I think the Lord Mayor of Hull, I think it was, if that's the right official title. So
she got the civic crown for her services.
Thanks, Mandy. Thank you very much.
Thank you very much.
Have a great day.
Bye, everybody.
Okay, bye, Mandy. So, going back to the agenda, it's my report. As you know, I started on the 14th of September, and although I was involved in my induction before, it's now moving at a pace. And so I just thought I'd just highlight a few things that I've been involved in the last 10 days. Some of you will be aware we are in the process, and it's gone live, recruiting 2 non-executive directors to replace Peter, who will be leaving us in the not so distant future, but also Mike Cook, who had his last board meeting with us in July, I think it was. So we've got on with that. I've been working with Steve, but also Jenny and Katie from the office, and Sam, the lead governor too, and with the Appointments, Terms and Conditions Committee, to make sure we got the job description, the job spec in a way that everyone felt was going to get us the best response, but also with our recruitment agency as well. That's gone live. We hope that the schedule we've outlined in terms of how we move forward after the applications close, but also getting onto the panels we want to have in the interviews and ratification, subject to diaries, we hope to get this completed before Christmas, which I think will be really good if we can move at a pace on that and make sure we're well prepared for the new year. I attended a workshop organised by the Health and Wellbeing Board, and that was interesting because it was felt that whilst there's obviously a lot of discussion about governance and structures in the new ICS, the Humber Coast and Vale ICS, the members of the board wanted to really talk about what difference being part of the ICS will make to people's own journey in terms of our services across Humber Coast and Vale. And we had a really good discussion about wanting to make sure that we could look at both in a real and practical way some differences in the way we support people's journey through a health service better as a result of the ICS. I've also taken on Sharon May, who was obviously the former chair, her role working with the ICS on shaping the integrated care partnership. And I've met with Councillor Mike Harrison and Karina Ellis to talk about how we can develop discussion about what that partnership should look like, who should be part of it, and how does it relate to other work within the ICS. And we had a good meeting on that. I saw Mandy the other week when I attended the Bands 3-7 Leadership Forum, and it was good to see her there, but also to say hello to more members of staff. And I'm really hoping that over the weeks and months ahead, I can see as many staff in different ways to inform my understanding and experience of what the Trust is all about. I was really glad actually to have the opportunity last week to be able to meet some of the different teams as part of the virtual market stall event that preceded the annual members meeting. That was really good actually to hear from them some of the work they were doing, and was a really, actually to be honest, a bite-sized way to get to know a little bit more about what staff are doing and what they're engaging with every day. I attended my first Mental Health Chairs weekly conference call, which was helpful, obviously listening to lots of people who have been involved in these services for a number of years, but also it's interesting to pick up on some of the common issues that we've already touched on today at the board about how everyone's coped in the last 18 months and thinking what things will change, but what things might actually stay, because we've had to think differently about how we innovate and keep in touch with our patients and service users. And Michelle Hughes and I have met also to discuss plans for the external governance review, which will be taking place early in 2022. So it's not been bad for 10 days, and I'm just looking forward to, at a pace, doing more over the weeks and months ahead. So that's my report. Any questions? Not even a thumbs up? Okay, moving on then. Thank you, Francis. Thank you for that. Thank you. Okay, so moving on now to... And a clap. Thank you for that. Oh, now you see, there you go. I've always been good at starting applause in events. You've just got to have one person to start the clapping, and then everybody starts. It's good. So thank you for that, colleagues. Right, moving on then to Michelle and the Chief Exec's report.
Thank you, Chair, and welcome once again. And what a great first 10 days. Actually, that's really positive, and lots of variation as well. So that's really positive. As usual, I'm going to take it that people have read the report. There's a lot in there. It's very, very busy at the moment, both from a system-wide point of view with the integrated care system, but more importantly with our staff and the work that they're doing in really challenging times that are really busy. And I know we'll come on to a little bit of that later through Lynn's report. Just to pick up a couple of headlines as I normally do, I have started a little bit more face-to-face under infection control guidelines, and it's a pleasure to meet our staff. They are just truly amazing and unbelievable. I know I say that, but genuinely they are fantastic, and that's across the board from our corporate staff all the way through to our frontline staff. It's been a really challenging month for everybody. It was great to have the staff celebration week, and that was an accumulation of some of the work that we've been doing over the last 18 months. But we're going to continue to do a little reward for staff on a relative, about a monthly basis. But it was really great to see that week where we celebrated everybody across the organisation, and I've had some really positive feedback, and as I say, we'll continue to do that. John mentioned the Humber Youth Board. I mean, we've been sort of talking about how we engage with the younger population in relationship to the organisation, especially being a foundation trust. And it's great that Mandy has taken up the mantle of the youth board, and I've been privileged to be involved in those conversations, and it's progressing well. And I think they've decided that they want to rename themselves Humber Youth Action Group, and I think that's fantastic. And I think at some point, Chair, you and I need to have a conversation how we really start to get the work of that group influencing some of the work that we do here. So maybe we can have a conversation about that later. Great that Inspire have won some awards, from the building to the people and the clinical services, so congratulations for that. And we've also won a Health Service Journal Award that Hilary may want to pick up a bit later, which Patient Safety, which is our Children and Young People's team. As you know, we were shortlisted for I think about 5, and we actually won one category, which is fantastic. So well done to the Michelle, etc., and Zoe. And I think they've been on Radio Beverley as well. It was a privilege to go up to Whitby and see the opening of Whitby Hospital. It actually looks like a new build, really. I mean, I know it's the old tower block, but it is a fantastic design, and that will really benefit patients and staff up there. So it's fantastic. There's lots of awareness weeks coming up in October, so I'm not going to list them. There's a lot, from Black Awareness Month to Mental Health Awareness Day. There's a comprehensive report there, but we'll continue to support those. Vaccinations and care homes, it might be something that Lynn wants to pick up within her report, because obviously there was a mandate about mandatory vaccinations for COVID. Our flu programme has started, and we will continue to roll that out. We want to really intensify it over the next couple of weeks so that we can get the majority of staff through their flu vaccination before we start our COVID booster, which is in train. Few people movements that's in the report, and obviously I've related about the winter plan. Ours will come to the board, but this was the national and the regional winter plan, which I thought was really helpful. I met along with Hilary virtually the international recruits, because they're currently in quarantine and isolation, but they've come from a vast array of fantastic areas from Zimbabwe, Ethiopia, but what skill base the 7 nurses have, and they'll be a real asset to the organisation. And I thank everybody that's made that possible. It's really exciting, and I know that people will meet them as they continue their journey with us. I'm going to mention 365 because I have mentioned it in public before, but we are rolling out 365 Microsoft Office, and again I thank the IT team for that. We are getting used to it, but obviously that's been a major project in really difficult, challenging circumstances. So I thank staff for persevering with it, and I thank IT for persevering with staff who are persevering with the transition. Lots and lots of comms in the report. Comms have continued to do a great amount of work, both on Intranet as well as on the website, and continue to do a lot more work in relationship to raising profile, etc. And again, there's Health Stars report there as well. There's no policies to ratify this month's, Chair, but I'll pause there and just throw it open to my colleagues if anybody wants to add on anything that I've said before we take questions. So I don't know, Hilary, if you want to mention a bit more about Health Service Journal Award, but again, I'll leave it up to my colleagues. Thanks, Chair.
Shall I mention about HSJ? Yes, the work we put in for 4 categories, lots of competition, and walked away with one, which is fantastic because it's our first HSJ Patient Safety Award. It was in the Improving Care for Children and Young People's category, so it's fantastic. And yes, I think they're on the radio today, aren't they, Michelle, talking about the award?
Yeah, they've been on Beverley Radio. It's fantastic, but it's really, really impressive because, as you know, the Health Service Journal Award, there's thousands and thousands applying. It's a really rigorous process. So it really just, it's really just to celebrate how great some of our, all our staff are, but some of our particular initiatives are really good. Thanks, Hilary.
Anybody else from the exec team would like to add something? Lynn?
Yes, thanks, Chair. Shall I touch on the COVID report, as Michelle suggested, and pick up the issue around care homes and the work that we've been doing there? So I guess just by way of summary, obviously infection rates actually remain quite high during the latter end of August and September. That to our increase in the number of patients in our mental health inpatient beds. So we had 11 cases overall of patients who were COVID positive. That did lead to some reduction in availability of beds as wards were closed for infection control reasons. Staff absence has been stable, as it was similarly reported in July as well. And we did see the tail end of what became known as the sort of pandemic around obviously staff being contacted through the app. That did lead to some change in the national guidelines around being able to return staff to work under certain circumstances and with particular risk assessments in place. So that certainly helped in terms of staff availability. Operational pressures have remained high through August and September. I guess a few factors really. Obviously, demand has plateaued, which, to be fair, we usually see generally across services through the sort of summer break periods. But obviously our staff are taking leave and breaks through that period as well. And whilst absence is stable, I guess overall we would like to see some reduction, particularly in some particular areas. So we've maintained sort of OPAL pressure reporting around sort of OPAL 2, OPAL 3. The system, however, has remained very hot overall. So we've seen system partners, particularly the acute hospitals, very frequently reporting both Scarborough, York and Hull at OPAL sort of 4, 3 periodically, and similarly around the local authorities, again, particularly Hull, where we are seeing that continuing pressure around the provider market and the impact of that we're seeing around discharges in the system as a whole. So that really remains a pressure. As Michelle says, there is a national requirement that any professional staff entering care homes from November need to have evidence that they have received both COVID vaccines. We've done a piece of work just to assess from our point of view all of our staff who are in that position that they would need to enter care homes for clinical purposes and what the vaccination rate is. We've done some work too where we've needed to have those conversations with staff to improve it. We've obviously done some data cleansing as a consequence of that work as well. But we have received a position where we are assured, as it stands at the moment, that we have sufficient available staff to meet the demands for our work in care homes. Obviously, we'll continue to keep that under continual review. CAMS and primary care remain areas of pressure, but again, demand in CAMS has plateaued, as it typically does. So again, obviously, we're really focused on winter planning. There's obviously a report later on today's agenda around making sure that we're in a position to meet the ongoing demand across all of our service areas. Maester Lodge, the capital programme work is now complete, so we're just finalising the final sort of elements of recruitment to get those beds open in October. So that will help our pressures around older people significantly. But it may be useful for John perhaps to update around COVID vaccine and the booster position around that. And obviously Steve is SRO for flu. Flu is very much part of our sort of winter preparedness as well, and making sure our campaign is successful. But I'll stop there if that's okay.
Thanks, Lynn. I've got Pete and Michelle and John. John, do you want to just come in on the vaccine just to follow on from Lynn there, and I'll then come back to Pete and Michelle?
Thank you, Chair. So look, there's been a lot of stuff in the media over the past month about waning effectiveness of the vaccine. So you don't mind me just putting that one to bed at the start, Chair. So the vaccine was developed with the key to reducing mortality, in other words, stopping you dying from COVID and keeping you out of hospital in terms of ICU admissions. And from that point of view, the vaccine is absolutely doing what it needs to do and is as effective as it ever was. We always anticipated that there would be some waning of effectiveness of the vaccine with regards to mild to moderate disease and perhaps reducing transmission. And we're seeing some evidence of that in studies that have been done over the summer in terms of the antibody levels dropping off. But that does not mean to say that the vaccine isn't working in terms of moderate to severe disease, which it absolutely is. So with that in mind, the government are introducing a booster program, which is essentially for everyone aged over 50, working in frontline health care, or if you're under 50 and considered extremely clinical vulnerable. So I think that's about 15 or 16 million people off the top of my head who will need a booster dose or a third dose, whatever language we want to use. In our trust, we'll be rolling that out to our own colleagues weekend beginning the 15th of October. Two reasons for doing that is one, that we wanted to make sure we got through the flu campaign as quickly and promptly as we possibly could, because we felt we'd have higher uptake amongst our colleagues if they had them sequentially, not both at the same time. However, we can give both at the same time if the opportunity presents itself in mid-October and people want to do that. We will be giving the Pfizer vaccine, and it'll be given out in the lecture theatre as we did the first part of the programme. So all of the plans are in place to do that, going live the weekend of the 15th. The reason we've held it back was we're also guaranteed supply at that stage, because the national programme was supposedly due to start in early September. We kind of anticipated there'd be some lumps in terms of delivery. So actually the fact that we've held it back a little bit just means when we do get going, in terms of being able to guarantee supply and stuff, we're confident that's going to be the case, which wasn't the case in the first part of the programme. So that's where we are with the COVID booster vaccine. All staff will be contacted. We'll have a booking site available. Colleagues who work up in Yorkshire or North Yorkshire, our colleagues in York Hospital have offered to support them with vaccinations too. And many of you will be getting contacted through your own GPs with booking links either by text or by email. We just make sure from a security point of view that it's a PUCA link that you've been sent, but actually we anticipate lots of people in the next week or so using the other resources which are available and to get themselves vaccinated. The key thing is you have to have a gap of 182 days between your second dose and your third stroke booster dose. So that's where we are with the vaccines. Very confident that there'll be a high uptake of the third dose, just like there was for the second dose, where it was a minimum 90% compliance.
Thanks for that, John. I'm looking forward to getting mine, I have to say. So, Pete, you're up next.
Thanks, Caroline. It was just a very quick update on the new hospital programme. So you'll see from the report, 300 expressions of interest went in. I picked up yesterday on a finance leaders event that has been whittled down to 127 being progressed for ministerial consideration, of which 20 of those are in the North East. So obviously they've whittled out quite a number, but I think it's still important to note there are only 8 schemes going to be progressed.
Thank you. And Michelle?
Thank you, Chair. Just briefly, going back to the Youth Board and to confirm that we're working with Mandy to link it into the Governors Group, the Engaging with Members Governor Group. So regular updates will come through yourself and the Council of Governors from that group. And just secondly, given that we didn't have a board in August, just to highlight that our new intranet launched in August. It was developed with staff and it supports staff and gives them the tools to assist with their jobs. And the numbers in the report and the use of the platform are just incredible. So a real credit to everyone that was involved in that. Thank you.
Thanks, Michelle. I think we've covered the management team, unless Steve wants to add anything in there. I can't see him indicating. No? Okay. I've got Francis and then Peter.
Thanks, Chair. First of all, just a well done on Inspire, on Whitby, on Helen's nomination and on the practice education team. Again, it just shows the breadth of what we're doing, so well done to everyone. A couple of questions. Lynn, the COVID update, excellent, but a couple of questions on it. In terms of recruitment for CAMS and PICO and Maester, I just wondered how we were managing with that in terms of trying to get those extra beds open.
Yes, thank you. So we've got 2 PICU beds open on Inspire currently. We have recruited successfully to plan to open the remaining 2 around sort of the beginning of December. I guess why we are being a little bit cautious around that, because the staff that we've recruited, it has been successful, but we want to obviously make sure that they've gone through their induction and training. You'll probably be aware it's actually very difficult to recruit very experienced CAMS staff, which is why that induction and training element is really key for us. But we will open those remaining 2 PICU beds as quickly as we possibly can. And we're constantly engaging with NHS England around where we are with that at the moment. The Maester beds, as I said, we are at the tail end of the recruitment. That has been positive, and we expect to open those beds in October.
Great.
Thanks, Lynn. Peter and then Hanny.
Sorry, I had a couple more.
Oh, sorry, Francis. Did you want to come back? Sorry.
Yes. Sorry, there was a few other questions I had before.
Sorry, Francis.
And just for John, maybe on the primary care side, you talk great on what we're doing within the trust. What's the pressure like on primary care for flu and then obviously for booster?
Francis, I really can't give you an answer for that. Our own services will be participating. So the flu stuff in our own GP surgeries is standard business as usual. In terms of the COVID vaccination, that is still commissioner-led through the CCGs. And where appropriate, our surgeries will be supporting the PCNs to do that. In terms of the booster dose, I think it seems to be an awful lot more flexible this time when we're seeing more community-based pharmacies and other providers stepping in to fill some of the gaps. So that will take some of the pressure off some of the practices in terms of delivering the COVID.
Okay. And then just a couple of one final question on page 42. It's 5.22. The patient safety partners. Again, great work there. I was just wondering how you're going to advertise or target the recruitment to get the right kind of people. I don't know who's that is best addressed by.
Shall I pick that one up? Yeah, that's in my section, isn't it? We're working very closely with Mandy, so I think she did mention it in a report as well that this is the work that we're doing. So obviously we will use Mandy and Mandy's networks to make sure that we get the right people in those posts.
Great, thanks, Helen.
Thanks, Francis. Peter.
Thanks, Caroline. Yeah, just three sort of maybe quick ones from me. Just on, first of all, on page 38, we talk about staff health and well-being. I just wondered at some point, not maybe today, but we found out a little bit more about what's happening at the BAME network that we set up about a year ago, and how effective that is in terms of the dealing with and raising issues regards health and well-being of BAME staff. So perhaps we could pick that up at a future date. And then on page 41, we talk about zero events. I was looking for something on information governance, but I don't know if that's covered somewhere else. But they all seem to be sort of clinical areas rather than more general areas like IG. And then the other question is on international nurses on page 43. I'm glad we're getting 7 in, and we're going to have more in, up to 20. I just wondered on what basis they're coming in. Are they coming in permanently, or are they on a 2-year visa with a view to going, developing their own skills, if you like, to go back to their whether their country of origin originally, or they're coming over permanently? So I'm just looking at sort of the areas where they're coming from, like Zimbabwe and Kenya and whatever. I just wondered if it's part of an overall development program where they go back with increased skills in at a future date, which is a benefit to a less well-developed country.
So I pick up a couple and then bring in some colleagues, Caroline? First of all, if we go to the recruitment page, just add on to the recruitment piece. As you know, we've been doing quite a lot of sort of local recruitment, but also recruitment with our colleagues. And it's just to raise awareness of, do you remember the East Riding Shush campaign that was about, keep it quiet, East Riding is a great place to work, etc., etc. Well, that really has taken off over the last couple of weeks. So it's going to be on Look North tonight as well. So that's really positive. So we'll continue to do things like that, as well as just do the standard recruitment, like work with colleagues and work with areas. I think Dean's probably put in the chat box, I've not seen it, what I was going to suggest about the BAME network, because I think you're right, it's a really good question. And I know they just recently had an appointment process for chairs. It might be useful for the workforce committee just to have a look at that. And I know Steve's on the call. I think Steve could add to that. They are doing a lot for Black for Awareness Month next month as well. So there are some great work there, and I keep dipping in and out of those meetings, and they are really gaining momentum. But it's a really good question. I pass over to Hilary about the international recruitment, but they are here with us. We want them to stay. We want them to stay in the organisation. We want them to continue their journey with us, and the skills that they bring are phenomenal. They really are impressive. I think the least experience they had was like 2 years post registration, which is not insignificant. And obviously they'll go into our community and physical health areas first. But I'll pass it over to Hilary and anybody else, maybe Steve, about the BAME network. But thanks, Chair.
Thank you.
So yeah, the international recruitment nurses, we definitely want to be keeping them. There's substantive positions that they'll be going into. Certainly from meeting them this week, they were very much across here to develop their skills, learn, very pleased to be in the UK. None of them had been in the UK before. We're putting an enormous amount of pastoral support in for them to make sure they settle and they settle well. And we will keep hold of them really as they go through this journey, probably for months, if not maybe even longer than that, in terms of got a peer support group for them. Obviously, cultural differences, we've got a lot of work to do with them around that as well, and make sure that they get well embedded within our trust and want to stay. Certainly talking to colleagues in other trusts, the majority of the nurses they bring across do stay. So that's what we will obviously be looking for. Certainly not anybody muting that they're coming here to get some more skills and go back. A lot of it is actually coming to use some of the equipment that we have that they don't have, and learn all about that. The technology that we have to support nursing. That certainly was what they were muting to me, was how that interest in that and that development. So hopefully with all the pastoral care and being able to get them to get well embedded in our services and supported, and if they've got families, bringing the families across eventually as well, they should get settled in our communities, which is certainly what we're aiming for, Peter.
Thanks, Hilary. Any other members of the executive management team want to add anything in answer to some of those questions raised before I move to Hanif? Steve?
Yeah.
Thanks,
Caroline. Just to come in on those 2 bits. So again, maybe just worth reiterating that the nursing intake that we've got was part of our work plan that we discussed through Workforce and OD Committee. So it's part of our strategy to bring nurses in. I think that to have that plan of 20, Peter, and to have sort of permanent roles within that. So it's great that it's been starting to be delivered on. So that's fantastic, and hopefully we'll see more colleagues as that moves along. On the BAME network, so we do get an update at Workforce and OD Committee every meeting from an update from the chair of that particular group about what's covered off. So I think Dean's put something in the chat box. So we could either do that as part of Dean's assurance report into this committee, or we could pick something up further if there's any particular areas that you want to focus on, Peter. But we've got that kind of mechanism, so that's quite easy to do.
Thanks for that, Stephen. And just for anybody watching today, and when we say BAME network, that stands for Black, Asian, Minority Ethnic, and it's a network for our staff across the trust. And October is Black History Month, and I've already got in my diary to do an event with the network, which I'm looking forward to. Hanif.
Thank you, Chair. Hillary's really responded to my point, which was really going to be around the wider support that we provide on the international recruitment, just to help them embed, and the fact that there are significant cultural nuances and differences for individuals of that background coming in. So that's great that we're providing that pastoral support. Just as a suggestion, I'm thinking in terms of good practice that have come across before, are we able to do a similar background? For example, if we've got nurses who are already here from India, that we can align them, match them up. I know what a huge challenge it is for individuals to come across to a brand new environment at what is already a very difficult time in terms of gradually moving to a post-COVID world. So great, as I say, that we've got that pastoral